So I'm absolutely delighted to be here today, and as Donald had said, it's brilliant to be part of the first of anything, so thrilled to be the first person speaking about physical activity in rheumatoid arthritis. To start off, I do have some disclosures, and again this kind of led on from a trip I had to America recently and a conference I attended there. So first of all, my background is in physical activity, so that usually means that I like exercise, and that's my particular bias that I bring to this presentation, so just keep it in mind. And the third thing is, I think everybody can be physically active regardless of the condition that they have or the circumstances that they're in. So just to bear that in mind. I wanted to start off with a little bit about me, just so you know how I've gotten to this point. So I did my undergraduate in physiotherapy in UL, and then I was hooked into doing a master's in research which looked at physical activity levels in people who have inflammatory arthritis. And that was really a really interesting experience for me, because I had to go out to the clinics and actually speak to people who have inflammatory arthritis and learn about them and how being physically active is really, really tough for them. So that led on then to a PhD, and thankfully I finished that last January. My 86-year-old granny said, "Are you finally done now?" And thankfully I'm not. There's a lot more research to be done. So now I'm in that lovely postdoctoral phase where I want to do everything but don't have the money to do any of it just yet, so I'm working on that. And what was really nice is I was unfunded for all of my research, so I just had a fee waiver for my PhD. That meant I had to be in clinical practice, and that was actually really important because it meant that I could think about what was realistic, what the challenges were, and I wasn't sitting in an office all the time thinking of all these wonderful plans that would never work in real practice. So right now I am a practice tutor part-time for the MSc physiotherapy students in Galway Primary Care. So I was out with two of them yesterday. I was measuring movement ABC for an 8-year-old at 9 o'clock yesterday morning, and in the afternoon then I was doing a balance assessment on a 65-year-old lady with a student. So it's really nice mix. I also lecture part-time, and I'm always the guest speaker rolled out to talk about physical activity in arthritis, which I love. So a lot of my research to date has been thanks to my mentor Norlie Kennedy, who's head of the department in clinical therapies, and I've spoken to a few people about Norlie who did her PhD up this neck of the woods some years ago. And thankfully my research has given me lots of opportunities, and recently one of those was to take part in an exchange programme in San Diego at the start of November, where I was one of 10 European applicants to go in an exchange programme and really link in about research and making international connections. So it was lovely. Sunshine in San Diego was really, really nice. But most importantly, I got to go to the conference, the American College of Rheumatology conference. And the keynote on that address was, I missed it there, exercise is medicine, we all need to say the same thing. So some of the considerations that I'm bringing to this talk, and I don't really have strong opinions on them right now, but I wanted to keep it in your mind as we go through, and maybe we'll come back to them at the end for a bit of discussion. So the first thing is, as health professionals, are we all responsible for promoting health, or do I just mind my little patch as a physiotherapist of physical activity and stick with that? The second thing is, do we arm wrestle with instead of dancing with our patients? And I was showing this presentation to my sister last night, and she said, well, what do you mean? And what that means is, do I try to force my biases, liking exercise, on my patients or clients as they come in, or should I really be working in a partnership with them to find out how we can make them as active as they possibly could be? The next point I think is really important, and are we, and by me I mean everyone who is involved in healthcare, are we all saying the same thing? As Donald mentioned there, does our walk match our talk? So it's perfectly fine for me to say, well, you should be doing 30 minutes and you should be doing this and park your car further away, but did I do it? Maybe sometimes a little bit of self-reflection isn't the nicest thing. And then finally, and I think this is a really interesting point that came up at the conference, was, do health professionals need to look physically healthy when giving health advice? And that was really brought up a lot of debate. So we might come back to that at the end when there's questions and time for discussion. So a little quiz just to wake everybody up. Do we know the physical activity guidelines? Yeah? No? So what are we? Hands up, so who does? Who's confident? Some tentative hands going up there. Okay. So physical activity guidelines, we usually hear they're 30 minutes, 5 days a week. Do we forget about the other bits sometimes though, the strengthening and the flexibility aspect? Yeah, okay. In the past week, how many of your clients did you discuss physical activity with? So I'd like a show of hands for the really outstanding members of the audience who discussed it with 100% of their clients. Oh, great, this is fantastic. Anyone a little bit further down, maybe kind of somewhere between 50 to 75%? Anyone below 50% that's brave enough to put up a hand? Okay. And then finally, how active are you? And I don't need a total number of minutes, but just to reflect on how active you are in your life. And actually, I like to think I'm physically active, but I know I sat in the car this morning. I'm probably going to sit a lot of the day, and I'm going to sit in the car to drive home again this evening. So today isn't going to be a particularly active day for me. Okay. So now to move on to the purpose of why I'm here is talking about physical activity in rheumatoid arthritis. And it's an area I'm really passionate in, and I'm delighted to have a captive audience to listen to me talk about it. So I like to go back a little bit, and I always show this slide to the students. So I go back to the research and see what was advised years ago. So minimum of 2 weeks in bed, which I think might be nice for everyone, or we might immobilise painful or active joints for up to 4 weeks. And that message that being physically active is bad and rest reduces inflammation. And unfortunately, a lot of that message from years ago, when maybe the medical management wasn't as good as it is now, means that there's still a bit of a hangover, that people are still very afraid to be active. So the good news is that the evidence does say that exercise is safe in people who have rheumatoid arthritis, and we've lots of high quality evidence. So that's really a message I'd like to get out there. And from an earlier paper in 2006, which is normally my supervisor's research, right up into your Cochrane review and a 2015 paper. So right now the message is exercise is safe, but there's still fear out there. There's many benefits to being physically active when you have rheumatoid arthritis. So it goes from the disease specific to the cardiovascular effects, and we know the link between inflammation and cardiovascular effects in the body. There's bone benefits, quality of life, impact and symptoms such as fatigue and pain, which I think are really important for the people that we engage with, and also when we look at joints and radiographic message. So that's a really nice slide that, it's just lovely to show that there's so many benefits being physically active when you have rheumatoid arthritis. Unfortunately though, our physical activity recommendations, despite the benefits that we know of, they're a little bit lagging behind. So this paper from 2003 is actually the last paper which gave specific recommendations on being physically active. So that's 15 years old. And it's from a big research group in Sweden. They're the Physical Activity in Rheumatoid Arthritis research group. And I suppose it's not that different really from what the typical physical activity guidelines are. So I would always encourage that people who have rheumatoid arthritis target towards the generic physical activity guidelines, but we might need to plan a little bit differently if you're experiencing symptoms of an inflammatory condition. A more recent paper by the same research group then just looked at the benefits, and just even over an 8 to 12 week period, if you exercise 3 times a week, quite a large range there in exercise time, but you could have improved cardiorespiratory fitness just at the end of a 12-week period. If we do it over a long period of time, we'll also have increased muscle strength, and also if we do it for over a year, we'll have reduced activity limitations. So that's really important to highlight that. There is good news though, and the European League Against Rheumatism are developing physical activity guidelines for people who have inflammatory arthritis, and they're expected to be out maybe early next year, and Norley Kennedy is the Irish representative on that task force. So that's really positive that we'll have specific guidelines to go to for people who have inflammatory arthritis. So when we look at the numbers then, there's a little bit of discrepancy depending on what paper you look at. So the first paper is one that was done in the UK, a very urban population. It was a city dwelling population, and that showed that 61% were meeting the physical activity guidelines. Now it was only the aerobic component. Okay, I think what's probably a true reflection of the overall literature is the second paper, which was from 2008, and it showed that 86% of the people involved in that study exercised less than 3 times per week. And why that study is significant is it had 21 European countries involved, and the nice thick black bars are the percentage of people who are inactive, okay, on the screen. So I think that's probably a fair reflection of how physically active people who have rheumatoid arthritis are. Ireland isn't fair as well, it's up there at the top, so you'll see that over half are physically inactive from that 2008 study. And certainly any of the literature that's looked at rheumatoid arthritis physical activity levels across the board would say that the majority of people who have rheumatoid arthritis are physically inactive or active at insufficient levels. Okay. So part of my PhD was to look at, okay, well, what's happening here? So I decided to go out and interview people who have rheumatoid arthritis. And I did 17 interviews with people who have rheumatoid arthritis. And I asked them how much physical activity people who have RA should do. And this is what came back. So the message out there, and this is from all of the interviews that I did, that nobody really knew how active they could or should be when you have rheumatoid arthritis. So that got me thinking in my office in Limerick, what's going on? So why aren't people who have rheumatoid arthritis being physically active? We know it's good for them. We know there's certain recommendations out there on how active they can be, but the message isn't getting through to the people that we'd like to get through to. So there's lots of things that stop us from being physically active. Okay, we're tired, lots of things to do, there's lack of time, the weather, juggling other things, finances, the dark evenings at the moment are a big obstruction. And all of that holds true for people who have rheumatoid arthritis as well as ourselves. When we look at things that influence physical activity, it goes from an individual level right up to your global. So probably linking a little bit with the slide that Donal had on what influences maybe obesity, there's some things there that we can't control, and some things that are maybe outside our control. Okay. So where should we as health professionals be looking? I suppose probably somewhere in this realm here. We can't really change the environment that people are in, but definitely from a policy level we need to be thinking about how do we create environments for people to be more physically active. When we look at the literature then, there's specific barriers to people who have rheumatoid arthritis, the symptoms they experience, that having RA label, lack of support from family and friends, conflict in advice from the health professionals, and the other barriers that I'd highlighted earlier on. And I think the thing that was most concerning for me was that there was a conflict in advice from health professionals. So if I go to my rheumatologist and he says one thing, and then I go to my physiotherapist and she says another, and my clinical nurse specialist in rheumatology says another, then I don't know what to do because I'm getting all these conflicting messages. Things that can help people who have rheumatoid arthritis to be physically active would be support from health professionals, exercise instructors or family. The evidence would show that women are more likely to engage in exercise programs that are delivered than men, higher educational levels and income levels, and also if you go into something expecting it to have a positive outcome, then you're more likely to be involved. So when I was thinking about all the things there, I mentioned the interviews I did with people who have rheumatoid arthritis, and really the overriding message from that paper that we published was that people are unsure about how much physical activity they should do, and they're very fearful of increasing symptoms. So that fear kind of feeds into it. And then the conflicting advice from the health professionals who are, I suppose, supporting them in their physical activity is very confusing. So these are some of the quotes that came up from that study. So people are very afraid to push themselves too hard. They don't want to cause a flare-up, damage. They're frightened of being crippled afterwards, and they're afraid that they'll hurt themselves when they're being physically active. So after that, I decided to go and talk to the health professionals to see what they had to say, see what their feedback was. And actually what came through was that I spoke to 7 rheumatologists, I had 4 physiotherapists, a few clinical nurse specialists in there, all interviewed, and actually they were uncertain about recommending physical activity. So then that really gave me a clear indication of why people who have rheumatoid arthritis weren't being active, because the message wasn't getting through from the health professionals. We talked about what an intervention to promote physical activity might look like. And part of that was that it should be community based. So get it out of that acute, medically unwell environment. Put it in the community where it's much more accessible. As with the demographic I was dealing with was down in the west of Ireland, so there were things around travel, access that were important. When we asked both the health professionals and the people with rheumatoid arthritis who should deliver this intervention, the health professional that they wanted was the physiotherapist. We suggested other professions might deliver the physical activity component, but the physiotherapist was identified as the expert in physical activity. So thinking about what our advice should be, if we're looking at a population of people who are physically inactive or inactive at levels that aren't sufficient to get enough health benefits, what should we be saying? Should we be going in straight away with our physical activity guidelines and say you need to do 30 minutes 5 days a week, or do we need to start lower down and build on up? And my perspective is that some is good but more is better. So we need to start somewhere and build up. And I think it probably, you have to excuse my bias here, it's a bit like Galway and they're all Ireland's. So some is good, but a bit like Kilkenny, more is better. So that would be my perspective on it. And I think that's what we need to work towards. So things from a clinical practice point of view, we want to make every contact count. So every opportunity that we as health professionals have to engage with someone and promote physical activity or a healthy message, I think we need to embrace. We need to inform people about the benefits of being active and breaking sedentary patterns, but recognise that my experience of it, being physically active and being a physiotherapist, is very different to that of the person that's sitting in front of me. We need to think about developing our physical activity or sedentary behaviour goals, and that in particular is really important, is action planning, and that comes around really important. So if I like walking 5 days a week but it's really cold and wet outside, what's my plan B? I need to plan around that. And also when we look at inflammatory conditions, it's really important to acknowledge that there's good days and bad days. So what happens on a good day and what happens on a bad day? Bad days, we should aim for some sort of gentle activity, be it range of motion exercises, if we can't get out and about for a walk or do our exercise that we plan to do. We need to think about identifying barriers that might come up. So the weather being one, time being another, managing different activities that we need to do, and having strategies to overcome these. Picking out things that will help us to be active, so going for a walk with a friend, maybe having some sort of incentive as part of it, that's really, really important. The third point is interesting because I was just, when Donal was talking there about the tech and how we're switched on all the time, a lot of the research would say that if we have something to reinforce or monitor behaviour, it can actually be helpful. So we could think about things like pedometers, maybe a wearable monitor like the Fitbit, or maybe using apps on a phone to track how physically active we are. Just as a matter of interest here, how many people are wearing some sort of wearable Fitbit smartwatch that will monitor physical activity levels? Yeah, myself included. Now, how reliable would you say your monitor is?
Very.
Very? Did you ever pick up a few steps when you're driving the car, or? Yeah? Most people did? Yeah. So then the debate comes about, well, do we need to have a really accurate measure, or do we just need something to motivate us? Motivation. Yeah, so it can highlight how little you do. And actually, part of my research was looking at physical activity monitors, and I used one that's not really commercially available, the Activitiy, and you wear it on your thigh, it's about matchbox size. And we looked at how reliable and valid it was for measuring physical activity in people with rheumatoid arthritis. And what we found was it actually couldn't measure the steps taken, or the number of times a person sat up and sat down. But what it was useful for was measuring how much time a person spent walking and moving or being sedentary. So it's very important to be mindful that if you're giving someone a recommendation around using an app or a Fitbit, it's maybe not that accurate as an outcome, but if it's used as a motivational tool to increase someone's physical activity, then I think that's absolutely fine. So where to next with the research? So far has been a stepping stone, and at the moment we've just put together 3 funding applications. So Dr Norley Kennedy is leading an application where we've just put in there for funding to look at delivering the pilot intervention that was developed as part of my PhD research. The second 2 I'm looking at, and the first one is looking at health professional educational needs, because I think it came through very clear there from the research that health professionals are a little bit unsure about what we should do. So we're looking at doing a pan-European survey with colleagues in the UK and also in Finland, just to identify what health professionals' educational needs are in terms of physical activity promotion and healthy eating promotion. Okay, so that's one. The second project that I'm hoping to lead is looking at physical activity in juvenile idiopathic arthritis, and I was speaking to Dr Orla Killeen, who I'm sure many of you are familiar with, and she would say that the adolescent group of this population are really, really untapped, and that's where people tend to fall off the wagon in terms of physical activity, and it's very hard to get back on that wagon if you stop being physically active in your teen years. So that's the second project that we're hoping to lead. Again, all of this is dependent on money, so if there's any lottery winners among you and you want to contribute, you're most welcome to talk to me afterwards. These are some of the really important people who've been involved in this research to date. Norley, as I mentioned, Dr Alexander Fraser is the rheumatologist down in Limerick. Stephen Gallagher is a health psychologist, and he really kind of, enhance my understanding of what can influence behaviour and what we need to think about when we're looking at changing behaviour. Brigitte Nordgren is a researcher from Sweden, and she worked with me on the physical activity measurement study. Sean McKenna is doing some really interesting work around sleep and rheumatoid arthritis, and his research should be coming out soon. And then finally, Fiona Cramp is a colleague who we work with in Bristol. So where to next? We're always looking for people who are interested in linking in with us. So the Arthritis Research Group at UL is a small but perfectly formed group, a total member of 3 at the moment. We sit under the Long-Term Conditions Research Group in the department. If you want to contact us, my email address is there, and I'm on Twitter. I do occasionally tweet a couple of updates here and there. So I've come back to these considerations at the end, and I kind of on purpose didn't put in a full 30-minute talk because I'd like more discussion and debate around these points. Some people have very strong views on some of these. I certainly witnessed that when I was in San Diego. And I'd really just like to open the floor to any questions or your thoughts or comments on the points that are on the screen. And thank you very much for your attention.